Hello students, welcome to MCQ video discussion on Medico apps. I, Dr. Ankita, today will be discussing a MCQ on dead tracks. Dead tracks is actually an important topic, especially when it comes to a short note question in the examination, in your theoretical examination. And this can even be asked as a viva question sometimes by the examiner. So let's resolve this MCQ and understand what exactly do you mean by dead tracks. But before that, I want you to subscribe our YouTube channel by hitting the bell icon so that whenever I discuss such important MCQs for your PG preparation, also some short important dental topics, you will be notified for all those. So let's start by hitting the bell icon and then let's resolve the MCQ. So the MCQ here of dead track basically is a question from DADH, that is your dental anatomy and histology. It basically belongs from a histology topic. Now this question has been asked in some local PG exams along with your All India PG examination also. It was not specifically asked, but it was asked, which I'll be mentioning you when I'll be explaining you what exactly is dead track. Now, why I am saying that this question belongs to dead track? Because the key point here will be dead track, and let's see what is the question which is asked here. So the question asked here is dead tracks in ground section appears as. So as I have told you, the key word here is dead tracks. Okay, it is asking you about the dead tracks. So to resolve this MCQ, we should know about what exactly do you mean by dead tracks. But before that, I want you to discuss the options which are given in this examination, in this question, so that we can eliminate the random question, we can eliminate the options and get the particular answer, the right answer for this MCQ. So let's see what are the options. So options here are A, dentinal tubules, B, coarse fibril bundles arranged at right angle to the dentinal surface, C, black in transmitted light and white in reflected light, and D is white in transmitted light and dark in reflected light. So it is asking you that does dead tracks appear among them? How does they appear? So let's start by understanding what exactly is dead tracks. So I'll be quickly explaining you in this lecture about the dead tracks. So let's start by understanding first the basic phenomena. So when we take a ground section of a dentine, that means a ground section means when we are taking a section of a tooth for histological examination and viewing under the microscopy, that is known as ground section of the dentine. So here ground section of the dentine, that means we are taking a part of dentine, we are taking a section of dentine and then we are studying it under the ground section. And that ground section, as I have told you, is studied under the microscope under the transmitted light. Now when we see under the transmitted light, sometimes we can see a group of dark lines which follows the course of the dentinal tubules, which are known as dead tracks. Now, when we see under the transmitted light, this is a key point here, do remember this. When we see it under a transmitted light, we see a group of dark lines. Okay, we are seeing a group of dark lines as you can see in this image, which follows the course of dentinal tubules. Now, as we know that dentinal tubules are a part of dentine, they are present in the dentine. Now, what exactly do the dentinal tubules do? So, they are tubules-like or hollow space-like structures that connect the enamel cementum to the pulp presenting in the dentine. Basically, they help in carrying the sensation, the field sensation to the pulp. Okay, so these dentinal tubules are present, as I have told you the word tubules, so they have a tubular structure. Okay, so these dark lines follow the dentinal tubules. So these dark group of lines, we call them as dead tracks. Now, why are we calling it as dead track? The lines which we are seeing are dark. So for that, we need to get into a little more detail. So for that, you need to understand that these dentinal tubules basically consist of odontoblast process. So these are the dentinal tubules which you are seeing. If this is a dentinal tubule, it is a hollow space. It consists of odontoblast process. So as you can see, these are the odontoblast processes which you are seeing. So this basically is a dentine. This hollow space is a dentinal tubule, and inside that goes the odontoblast process. Now, what exactly happens? So these dead tracts are nothing but group of degenerated odontoblast processes in the dentinal tubules. Now, how are they dead? They are dead because of certain injuries or insult to the tooth. Like, for example, if there is attrition, if there is caries, if there is trauma to the tooth, these odontoblast processes, they are dead. And these dead and degenerated odontoblast processes in the dentinal tubules are known as dead tracts. And how they are called as dead tracts? Now, when these odontoblast processes will die, okay, they will be dead. So these tubules will be empty. Okay, if they are not present, definitely the dentinal tubule will be empty, and these empty spaces will be filled with the air. Okay, and these empty spaces will be filled by the air. So when we take the cross section, now when we take the ground section of these dentinal tubules which are filled with the air, they under the transmitted light they appear black, and under the reflected light they appear white. And that is the answer for our question, which had asked that the dead tracts in the ground section appears like. I hope you have understood that the dentine consists of dentinal tubules, and inside these dentinal tubules they contain odontoblast processes which are dead because of certain injury to the tooth, and due to as they are dead, they are empty and they are filled with air and fluid. And when we take a cross section of such dentinal tubules which are empty, filled with air and fluid, they are transmitted. Under the transmitted light they appear black, and under the reflected light they appear white. So I hope you are clear with this much of important dead tract definition. I hope you have understood till here what exactly do you mean by dead tract. Now, along with that, sometimes it is also seen that a reparative dentine seals the dentinal tubules at the pulpal ends. Now, what do you mean by that? So basically, as a phenomena, as a body mechanism, the body starts forming a layer, a protective layer to fight against the inflammation, okay, so that there is no infection or inflammation that may reach into the pulp. So what they start doing is the pulp starts producing a reparative dentine. Okay, so this is a reparative dentine which you can see. Okay, now when a reparative dentine is formed, definitely the dentinal tubules will be sealed. So if these are the dentinal tubules which are forming, and there is a reparative dentine which has formed above the pulp, this is a pulp and this has formed, so definitely these dentinal tubules will be blocked, they will be sealed at this reparative dentine. Now, once they are sealed, again the dentinal tubules, they don't have any odontoblastic process. So again, they will be filled with fluid or the gaseous substances. Like I have already told you that they will be filled with the air. So such kind of group of tubules, okay, such kind of dentinal tubules, the group of tubules will be having, or they will entrap the air. And again, they will appear black in transmitted light and white in reflected light, which I have just mentioned. But here I am also mentioning that a reparative dentine seals the dentinal tubules. That means a layer of reparative dentine is formed. And here I want to also mention one point, that this dead tract is the initial phase of the sclerotic dentine. Now, what exactly is sclerotic dentine? Sclerotic dentine means a translucent dentine is formed when the odontoblast or the dentinal tubules are calcified. Okay, and that occurs due to the any sort of injury or any sort of caries or lesion which has occurred in the tooth. So I hope you have understood this point also. With this, as I have told you, the etiology behind the dead tract, how does this dead tract occur? So this can occur due to caries, attrition, abrasion, cavity preparation or erosion. Anything Any cause among them can be a reason to form the dead tracts. And lastly, a very, very important point, that what is the location? Where are these dead tracts most commonly seen? So these dead tracts are most commonly seen along the narrow pulp horns. Now, why narrow pulp horns? Because as you can see, these are the narrow pulp horns you can see, and near these narrow pulp horns there is crowding of the odontoblast, and that is why lot of odontoblast processes will be dead there. Okay, and these dentinal tubules will be present there. So if there is no odontoblastic process, lot of air or gaseous substances will be entrapped here, and they will appear more of blackish in color, as you can see in this image. So the most commonly seen location is near the, or it is the area of the narrow pulp horns. So with that, I want to also discuss the significance. So what is the significance? What does this dead tract causes? So these basically demonstrates it decreases the sensitivity of the tooth of that particular area. It is also seen more in older teeth due to the aging process. And lastly, the dead tracts are possibly the initial step in the formation of sclerotic dentine, which I have mentioned. So with this, let's go back to our question, which had asked that the dead tracts in ground section appears as. So do they appear as dentinal tubules? No, they are not dentinal tubules. The second option here is the coarse fibril bundles arranged at right angle to the dentinal surface. No, they are not even bundles of fibers which are arranged to the dentinal surface. Do they appear black in transmitted light and white in reflected light? Yes, they do appear black in transmitted light and white in reflected light when we have taken a ground section of the dentine. Okay, that is the answer which we are looking for. And lastly, option D also you should know, white in transmitted light and dark in reflected light. No, this is not also the option. So option C is the answer for our question, that dead tracts in ground section appears as black in transmitted light and white in reflected light when we take a ground section of the dentine. So this is the answer for you. I hope you have understood this small short topic of dead tracts also, along with resolving this MCQ. So don't forget to subscribe our BDS Express YouTube channel, and in case you want such kind of daily updates along with the important MCQ discussions, you can join our exclusive WhatsApp group on www.medicoapps.org/group. The link of this group is also given in the video below, so you can join our group. So keep watching, keep learning. Good day for now. Good luck.